Sometimes people set their personal views aside and change to benefit the majority. But at what point does this turn from being considerate to unethical? Person versus society. It's a difficult battle, facing one's own moral code and self against the majority. What happens when the person isn't what society accepts? Are they supposed to pass as something they're not, or stay true to themselves? There is a group of individuals in this world dealing with that exact predicament. These people are referred to as hermaphrodites, or the newly appointed term intersex. Intersex is defined as someone who is born with ambiguous genitalia, whether that means they contain both the genitalia of male and female anatomy, their male or female genitalia are atypical in shape or size, they have a hormonal imbalance of estrogen and testosterone, or they have a chromosome makeup other than XX or XY. It is estimated that about 1 in 2,000 infants are born intersex. Many people aren't sure whether to raise these people as male or female, and the point is that they shouldn't have to be either. The point is that intersex people should be treated with the same basic ethical rights as every other human being. But many parents aren't accepting of the thought of raising a child intersex. It has been a consistent medical practice since births in hospitals have become the preferred method for delivering children, for doctors to remove a clitoris if it's too large or close up an extra large opening in a penis. Recently, people have begun to protest against such medical practices, claiming that no surgery should be performed without consent. Those who have had children who are intersex have often opted to get corrective surgery to the infant or in early childhood to make the child physically one clear gender. This can seem like an easy route to take for the parent, as a child growing up intersex could potentially face ridicule and a psychologically difficult childhood. However, the parent making the decision for the child takes away their basic rights to their own body and sexual identity, as well as can be potentially damaging to their overall health. Doctors in favor of performing the surgery at the earliest age possible are looking out for the child's psychological well-being, as well as a heftier paycheck. Now, the concealment center model is still the preferred way to respond to an ambiguous child. This practice normalizes the child as one clear gender, and in most cases, keeps the surgery a secret from the child. Parents agreed to a silence code that leaves children clueless about their born gender identity until old enough to legally have access to their medical records. Gender identity is the way a person identifies themselves as being male, female, intersex, both male and female, or neither. The way someone identifies themselves in terms of gender is not necessarily because of their given sexual anatomy, nor because of sexual orientation. It is both developed from nature and nurture, and sometimes takes years for a person to come to terms with. Designating an identity for a child may negate the way they feel internally and cause harmful, conflicting emotions. Parents worry about the psychologically damaging effects of being raised intersex, but what about being raised to be what others want them to be instead of who they are? And what happens when a female discovers when she's 21 years of age that she was born male? Do they expect there to be no psychological effects? Parents and doctors choosing this route hope the child never has to learn of their true identity, intersex. But being born intersex is not just common, it's also not a medical danger. Many doctors have come forward saying this procedure is about as medically essential as a facelift. Through the process of medicalization, humans have taken a mere birth variation and made it a defect. Some intersex people are born infertile, causing people to believe it is therefore a damaging problem. However, plenty of people are born infertile without being intersex, and no one considers it harmful to their health. Few intersex individuals are born with metabolic problems, and this can easily be treated without the use of surgery, and this relationship is correlation, not causation. There is no evidence that states having ambiguous genitalia can be harmful to one's health. Though one can grow up healthy being intersex, having surgery at a young age to change this can have severe health consequences. It increases chances of affecting fertility, sensation, and sexual function. Those who undergo a reassignment surgery should be aware enough of the risk involved and informed enough to make a proper decision. Parent deciding the surgery for the child takes away their right to consent over their own bodies and forced to adjust their lifestyle to accommodate growing up the way their parents decided them to. Most intersex individuals having undergone surgery early in life have to receive multiple surgeries and constant checkups, which prevents them from growing up normal. Since this is the main reason to opt to get the surgery in the first place, parents should realize that because of the standards of our society, an intersex individual would never have a completely normal upbringing, especially since intersex individuals have the highest rate of gender reassignment later in life, whether or not they had the surgery as a child. In some cases, the surgeries are irreversible and the individual can never have a normal body. This can give the person a feeling of hopelessness and failure, since even after receiving surgery to be what their parents wanted them to be, they still weren't ideal. To minimize harmful surgical consequences and the amount of surgeries one undergoes, as well as take away the anxiety to live up to certain expectations, intersex individuals should not undergo surgery until they are able to give consent for themselves. There is also the option of an individual never getting surgery and instead living with the body they were born with. There are intersex individuals who did not receive surgery as a child who decide they want to remain intersex and not get reassignment surgery. A lot of these individuals claimed a sex as a child in order to have an easier experience dealing with peers. It is in fact much simpler to be either male or female and follow the standard traditions of socially constructed gender roles. Although this is the case, that doesn't make it the right answer. Being intersex is not a new condition, nor an uncommon one. The very idea that one has to be either male or female is completely decided by humans. Perhaps if the general public had a better understanding of this condition, it would no longer be looked at as a negative one. Perhaps we should stop looking at intersex individuals as being atypical. Difference does not equate to disease. To handle growing up intersex or raising an intersex child, therapy is a terrific option. There are many counseling services for people learning to understand and accept this condition. Group therapy can also help the intersex individual to accept that being intersex isn't abnormal or strange. There are many support groups that allow families with intersex members to connect and share experiences. As for gaining social acceptance at school, it is up to the individual. Some advise having information distributed to classes at a young age so that other students know of the individuals being intersex. Issues of dressing and using a certain bathroom as a child shouldn't be ignored, but they also shouldn't be the focus. A child can dress as they please. It doesn't necessarily have to fit a certain gender role, and this should be stressed for those who aren't intersex as well. As far as having a male or female bathroom, most schools also offer unisex bathrooms or intersex bathrooms where people can avoid this issue altogether. Wanting a child to use a certain gender's bathroom isn't a sufficient reason for an extreme surgery. Parental distress from having to raise a child intersex can be overwhelming. Our society focuses on gender roles, ideas of how males and females should behave. However, their distress should not be a reason to force a life-altering surgery on children who cannot speak for themselves. The surgery risks a child's life, emotional, and physical health. Not only this, but surgery also violates the very basic rights these individuals have to their own bodies. The issue shouldn't be how can we fix these people to make them okay for society. Instead, we should be changing society to make room for these people, to understand and accept them. In a battle of person versus society, for once, let the person win.